Hello, I'm Dr. Donester. I'm one of the dermatologists at Benefis Dermatology, and I'm here to answer some questions for you. Maskne is a problem that we've all become aware of in the last year, and it is something that, maybe lots of people didn't have trouble with acne or irritation of their skin, and now that you're wearing something that's occluding your skin and rubbing on your skin all day, it can cause a lot of trouble with the skin. So the most important things to prevent maskne are, one, to make sure you're doing a really gentle skincare regimen. You want to be really gentle when you're washing your face. You don't want to use any irritating products. That includes some of the acne treatments, including salicylic acid and retinoids, as well as exfoliators, anti-aging products. Some of those things can just be really irritating, and then when you put the mask on top of it, that causes problems. So you want to make sure that the barrier of your skin is healthy, and doing so you need to make sure you're wearing moisturizer every day. This even means if you have acne prone skin, you should still be wearing moisturizer. It helps protect that skin barrier and prevent irritation that can lead to acne. So all of these gentle skincare tips will definitely help with protecting your skin from maskne. The other thing you want to do is make sure you're washing your mask and using a new mask every day. Bacteria can build up and that can cause trouble. And then the final thing, is definitely, if you're able to, get vaccinated, and that will hopefully get us out of these masks sooner rather than later. So I think that's what we're all moving towards, hopefully soon in the future. So this is a very general question that's hard to answer without knowing what your specific rash looks like. But one of my tips is, if you have a rash that comes and goes and you want to get some help with it, a good idea is to actually take pictures of it when it's present. And that way, if you come to the dermatologist and your rash is not there, we actually have some idea of what type of rash it is, and that can really help us figure out the best way to treat it. Since this is in relation to showering, I did want to give some of my gentle skincare tips. And this has to do with how you shower and bathe and take care of your skin every day. And this can have a huge effect on whether your skin gets dry, itchy, or develops a rash. So number one, you don't want to be in the bath or shower too long. You want to keep it about 15 minutes or less. You want to make sure you're using a really gentle non-soap cleanser. So unscented Dove, Aveeno, Cetaphil, those are all options you can find pretty easily. You don't want to use a lot of soap. So really in the groin, under the arms, but you mostly can avoid it on the extremities, and you don't want to really scrub your skin a lot. That can also make you really dry and itchy. When you get out of the bath or shower, that is the best time to moisturize. So you want to just pat your skin dry, leave a little moisture on, and then you're going to put on a really good moisturizer. Many over-the-counter versions are available that don't have a lot of additives. You don't want to use a lot of fragrance or other things that can irritate your skin. Some of the recommendations are Vanicream, Cetaphil, CeraVe, Eucerin, Aveeno. So just find one that you like and that you're going to use regularly, but you should moisturize daily to really keep your skin healthy, especially in Montana where it's very, very dry. So this actually depends on your skin type and your risk factors. So one of the first things you need to determine is your skin type, and that's whether you tend to burn really easily in the sun. If your skin does burn very easily, then you're at greater risk for skin cancer. That said, even if you don't burn easily, but you're out in the sun all the time and getting lots of UV damage without sun protection, you are also at greater risk for skin cancer. The other factor is if you have a family history of skin cancer. Definitely if you have a first-degree relative that has been diagnosed with melanoma, so that's your parent, sibling, or child, then you should be getting a yearly skin check. If you have lots and lots of moles, you should come in for a skin check. People with over 50 moles have an increased risk of melanoma. And then if you have any sort of changing lesion, anything that's drawing your attention, seems different, then you should definitely have that spot checked. We do have what we call the Abcdes of Melanoma, and these are what you're looking for when you're looking at spots and trying to determine if you should be concerned. So A stands for asymmetry. If you were to draw a line through a mole, if one side looks a lot different than the other, then that could be a cause for concern. B is for border irregularity. Instead of having a really nice, well-defined oval or round border, you have an ill-defined border or a irregularly shaped border. C is for color variation. If your mole is one uniform color, that's not concerning, but if you have multiple colors in a mole, then you should definitely have that checked out. D is for diameter. If you have a spot that's larger than a pencil head eraser, that's more concerning than a smaller spot. And then E is for evolution. So if you have a spot that's changing, it's changing size, changing shape, changing color, itching, bleeding, irritating, any of those things, and we really want to see that spot right away. This really depends on the type and severity of rosacea that you have. So the type of rosacea, there's two very distinct, most commonly seen types, and one is called Erythrotolyngitic Rosacea. Erythro meaning red, and this is when you get very rosy cheeks or the central face gets really red. And telangiectatic meaning tiny blood vessels that start to occur in the central face. And the second main subtype of rosacea is papular pustular rosacea. And this is where you get little acne-like bumps on your face. And oftentimes patients will come in and they'll say, I haven't broken out since I was a teenager and now I'm getting all these breakouts. And often that can be rosacea. Rosacea generally presents in middle age, and it can be genetic, and so it is something, if it starts to flare up, then you probably should see your dermatologist, because the severity depends on how it's going to be treated as well as the subtype. So there are topical treatments we can use, systemic options, as well as laser and other options that can be used to treat rosacea. Now, if you have rosacea, just some general tips to kind of take care of your skin. So again, we are on gentle skincare. Lots of times when people have breakouts, they think that they need to scrub their skin or put a lot of different products on there, and that usually results in the opposite occurring, where you get more flares. So since rosacea is a chronic inflammatory condition, when you scrub your skin and put a lot of irritating products, you can actually make it more inflamed and worsen the problem. So I would just start out with a really gentle cleanser and a good moisturizer. As far as moisturizers go, sometimes oily skin does better with gel moisturizers, more normal skin does better with lotions, and really dry skin does better with creams. So those are things you can kind of look out for depending on your skin type. And then you also want to avoid triggers for rosacea. So my biggest tip, if you're rosacea prone, is to make sure you're wearing sunscreen every single day. The sun does flare rosacea, and also a hat is a really good idea just to block the sun from, irritating your skin. And so that can make a big difference in people that have rosacea. So acne over 50, one of the first questions is, could this be rosacea? So it may be something that needs to be evaluated in the clinic to determine if it's acne or rosacea, and that can be done by a dermatologist. And then as far as products in patients over 50, if your skin tends to be acne prone, I do like retinoids. They work really well for acne, as well as dark spots, wrinkles, and a lot of other issues that come up with aging. Now, retinoids are available over the counter as retinol, as well as Differin, which is adapalene. And so those are the ones that you can buy over the counter, but there are a lot stronger versions that can be prescription strength that your dermatologist can prescribe for you. These products can be a little difficult to use because they can be slightly irritating to the skin. So you do want to start out using a very small amount and only about 3 times a week and see how your skin is going to respond to it. If you're not having any dryness or irritation, then you can slowly up the amount of times you're using it weekly until most people can tolerate it using it nightly. But this can be a very good product for acne as well as changes you see in aging. So for hidradenitis suppurativa, also known as HS, this is a condition where you get nodules and boil-like lesions that occur under your arms, under the breasts, in the groin, and the inner thigh. They can have some discharge, be painful, and can also lead to scarring. So HS is actually a disease of follicular occlusion, and it occurs in people that have a genetic predisposition, and there's an interplay between hormones and inflammatory factors that can lead to this flaring. So it depends on the severity of the condition and how it's treated. Some of the ways it's treated is with topical therapies, including topical antibiotics, as well as oral antibiotics. And there are also some newer systemic options if it's very severe. This is a condition I would definitely have you come and see a dermatologist to have it evaluated, as it can progress and lead to scarring, and so we really want to see what options are available to keep it under control as soon as possible. As I said before, there are not things you're doing to cause the HS, but there are things that you may be doing that can exacerbate it. So you do want to avoid smoking and excessive weight gain. Those are 2 factors that can worsen your HS. But definitely, if you have questions about this or concerns that you may have HS, please contact our clinic and we'd be happy to see you. So obviously I love sunscreen because I want to prevent skin cancer, but another reason you want to be wearing your sunscreen is to prevent signs of aging. So the sun leads to wrinkles, dark spots, and other signs of aging that can be prevented by really good sun protection. So whenever anybody asks me, what can I do about my aging skin? The #1 response is you need to be wearing sunscreen, you need to be wearing a hat, and you really need to prevent those damaging rays from causing further signs of aging. If you already have signs of aging, there are things you can get over the counter, such as retinol, which I just discussed earlier, as well as sometimes bleaching creams can help, hydroquinone. So those are really the main topical things you can use, but sometimes topical is just not going to do enough for it. In that case, there are lots of laser therapies that can be really effective against dark spots and signs of aging, as well as some other newer interventions that can be really helpful. If you are concerned with changes due to aging, our med spa has really great nurses and nurse practitioners that are trained to take care of all of those factors. So I would definitely recommend making an appointment with med spa, and they can talk through further whether you just need topical therapy or if there's other interventions that you can consider. If your sunscreen is expired, you need to throw it away. We want you to have proper sun protection, and those labels are put on there, you know, to determine how long it's going to be active, and if you're using old sunscreen, it may not be effective and you can get burned or have other issues. So you definitely want to get rid of that. For sunscreen, you really want to make sure it's broad spectrum. Pretty much most sunscreens on the market are now. They block both UVA and UVB rays. You want to have a sunscreen that's SPF at least 30 or higher, and you want to get one that's water resistant. Now, one of my biggest tips about sunscreen is it doesn't last all day. So if you are outdoors for long periods of time, you do need to reapply it every couple hours. And the other thing is you don't just use sunscreen in summer. Sunscreen is meant to be used all year round. You do get, anytime the sun is out, you're getting some UV radiation, and that can be damaging on the skin over time. So if you are doing sunscreen correctly, you should not have any expired bottles around because it should be on your skin. And for your skin, you want to make sure you're using enough of it. So a shot glass is actually about the amount you use for a full body application. So you want to make sure you're using enough of it when you are applying as well. The other thing with sun protection beyond sunscreen is you want to try to use protection such as hats, long sleeves, seeking the shade more than the sun, and just really trying to keep yourself from burning or getting harmful UV radiation. As far as tanning goes, there is no safe tanning that you can do from the sun. It does cause UV damage to your skin cells, so there is never a recommendation to tan and for any reason. If you want to get a little more color, there's a lot of other options now. There's the sunless tanners that you can get. There's spray tans, and all of those are fine to do. The med spa does carry some versions of sunless tanner, so you can look into that. But there's a lot of new formulations on the market that can look really nice on the skin if you want a little extra color. Just don't get the color from a tanning bed or from laying out. That form of UV radiation is a known carcinogen, leading to increases of all forms of skin cancer, and so we really want you to avoid doing that. Silicone scar sheets are an effective way to improve the appearance of scars that occur after surgery or trauma, and they can be used and can be very helpful. The issue with them is they do need to be used for a long period of time, oftentimes months, to have a noticeable result. As far as how long you leave them on, I think you should look at the particular brand you have and see what the manufacturer recommends and follow that. But they can be effective if you want to try it. Milia are these little hard white bumps that occur usually on the face and can be very annoying and difficult to get rid of. First thing, you can't squeeze them. It's just going to really irritate your skin and not lead to much improvement. The way to get them out, they have to be extracted because they're deeper under the skin. That can be done by a dermatologist. The other thing to try to prevent milia is make sure you're using non-comedogenic products. This means that it's been tested that it won't clog your pores, as well as oil-free products. You can also try retinoids. They can sometimes be effective at preventing milia from coming up. Skin tags can be removed. They can be frozen off, snipped off, and taken off depending on the size and location in a variety of ways. As far as insurance coverage, you would have to check with your individual insurance because this is a variable thing for sure. So I would check with your insurance prior to coming in to have those treated. Itchy scalp can be caused by a variety of different reasons. So some of these reasons are due to a chronic inflammatory condition. That could include seborrheic dermatitis, psoriasis, or chronic folliculitis. And some of those have to be intermittently treated, and there unfortunately isn't a cure. This is a condition where it would really benefit you to have it evaluated by someone in our dermatology clinic to see, what the underlying issue is. Depending on what we're seeing on the scalp would determine how we would treat it. If you do notice your scalp is itchy and you want to try something at home, probably the first line treatments are the anti-inflammatory shampoos and anti-dandruff shampoos. So some of these can be effective at some of these chronic inflammatory conditions if they're mild. So things such as Head and Shoulders with zinc, selenium sulfide, Neutrogena T-gel, these can all sometimes be effective for the scalp, but if that is not leading to any improvement, then we'd be happy to see you in our clinic and see if there are further treatments or workup that needs to be done. So thank you for submitting questions for the May virtual health session. I've enjoyed answering them. If things come up, we'd be very happy to see you in our clinic. And if you have additional questions, please call, and if necessary, we can schedule an appointment, and we'd love to see you here. In addition, I did want to mention that May is Skin Cancer Awareness Month. So a lot of the tips I've given regarding sun protection, looking at your skin to make sure you have no concerning lesions, all of these are really important to consider. And if you have anything at all that you're worried about, please come see us right away.